Greetings everyone, Dr. Melanie Crites here with 360 Pelvic Health Institute and the Center for Men's and Women's Urology, coming to you today from Portland, Oregon with another segment. And I want to talk to you today about a situation that I have encountered actually several times in the last couple of weeks. I have had patients who have come in to see me for frank blood in the urine, meaning they are peeing blood. And when you see something like that, unless you are a very experienced kidney stone former and you see this routinely, this sort of scenario can be very, very scary for people, and it can happen to both men and women alike. So I want to talk about this. The patients that I have seen in particular, and you may be one of these patients who have this situation, they have had pelvic radiation for things such as prostate cancer, uterine cancer, various vaginal cancers, and colon cancers. Well, what can happen is that can cause what we call a radiation cystitis, meaning inflammation of the bladder caused by radiation. We also see it happen with the bowels as well, called radiation proctitis. But for our purposes today, we're talking about the urinary system. So what happens if you've had radiation to the pelvis and all of a sudden you start peeing blood? Certainly that can be very disconcerting and very alarming if you're not used to seeing this. So typically what happens is you'll see your doctor, they will put a camera inside the bladder and take a look around. Now when we do that, we will oftentimes take biopsies as well, because radiation to the pelvis, and especially situations where it causes radiation cystitis or that inflammation of the bladder, it can cause secondary cancers, meaning that inside the bladder, the radiation effect can cause a bladder cancer, if you will. So oftentimes we will take biopsies. And I'll tell you typically what we see when we put the camera inside the bladder is that we see what appears to be a very intense road rash inside the bladder. And when I say road rash, we're all familiar with having wrecked a bicycle or fallen in gravel, and we get that road rash appearance from the gravel or the pavement on our elbows and knees, and it can look really nasty. Well, inside the bladder, the same thing can happen. You can see kind of this road rash appearance. And what happens are these little areas break open and they start bleeding. And this can happen repeatedly as a result of radiation. Now the good news is it can be very treatable, and we use a series of what we call bladder cocktails here in the office to help settle down the lining of the bladder. Sometimes we'll mix steroid in with that to help settle it down a little faster, but there are oftentimes another treatment option that we will suggest called hyperbaric oxygen therapy. And basically what that is supersaturated oxygen that you breathe in. We send you to a special facility. There is a doctor who specializes in hyperbaric oxygen therapy. This physician will evaluate you and will prescribe a certain amount of sessions, and you'll go into a little room and you'll sit down and you can read your book. Sometimes they'll put a little hood over your head where they are just pumping super concentrated oxygen into your lungs, which then helps to supersaturate, meaning very densely saturate your tissues with oxygen to help heal the lining. And we find that to be very, very helpful. So if you are one of these patients suffering from this condition, see your doctor, because there actually is a treatment for it to help manage the symptoms. So hope this helps everyone. And as always, thank you for letting 360 Pelvic Health help restore your confidence.